physician, Dr. Nili Kaplan-Myrth. Dr. Kaplan-Myrth, you have been advocating for the second booster to be made eligible to more Ontarians. I want to get your reaction to what we were hearing from Dr. Kieran Moore there and the tone that he set with this announcement that they're expanding the fourth doses to people 18 and up, but essentially it's not really that urgent for everyone.
So first of all, I want to clarify that getting a booster now doesn't preclude anybody from getting the next vaccine. And when he talks about the fall, in fact, what he's talking about is November. So when we are people who work in any field where we are in contact with others in the midst of a seventh wave, COVID rising exponentially in the community, and many of our families and our community members who are vulnerable are the same people who were struggling up until now to be able to access boosters. So it's a victory for all of those people who are healthcare workers, anybody who works in a grocery store, in a factory, in any kind of setting where you're interacting with others. Unfortunately, all the people who have children who are in camp or in school had multiple infections. The people who are least likely to be able to jump in their car and hunt for vaccine or drive to other provinces or across to the States weren't. Those same people were high risk and are still high risk. So it's a difficult message. There is a nuance, and to give Dr. Moore credit, one of the things that he's saying is if you're a healthy 20-year-old, perhaps you don't need a booster right now. However, I would also caution people that Ontario isn't going to do anything about long COVID. They're not going to do anything to help you when you end up with COVID and your family members end up with COVID and you're sick and you're not supported to isolate. And so what we should be doing is really encouraging people. Everyone should have at least their 3 doses, and people who want a 4th dose because they are out there in the community in any capacity should be able to access them, and now they can. Also, people should be putting on masks. And Dr. Moore was misleading when he said that Ontario is doing a good job of that. That is not true at all. Go into any community setting and you'll find that people are unmasked indoors and in crowds outdoors. People are unmasked. So we're not using all the tools that we should be. We should be masking. We should be isolating for more than 5 days. We should make sure that people have the supports that they need to do so. And we should be doing more testing. He mentioned access to PCR tests, but that's been inaccessible for almost everybody for like a good half a year. So we need to do more to support the community, and getting a booster may be the right thing for many people. There is no reason to delay until the fall. If you think that you're going to get something in September, it's not going to happen in September. So if you are at high risk, which is basically anybody who lives in a community where there's COVID all around us, and definitely for people who work in high-risk settings, which is anywhere that you're interacting with other people, especially if they're unmasked, then it might be a wise idea to get a booster.
Just finally here, Doctor, a lot of parents across the province are still waiting for, across Canada, are still waiting for Health Canada to approve vaccines, COVID-19 vaccines for children under the age of 5. The expectation is sometime this summer. So what are you recommending to your patients, to the families that you see?
So for the families who are waiting, all that I can say is that we do have to wait for that to be approved by NACI, by the Public Health Agency of Canada. It has to be, that is the first step. We have infectious disease experts who are going to approve it. When it is approved, we will make sure we get it out to you as soon as possible. The latest I've heard is hopefully the beginning of August, but we can't rush that. That will happen when it happens. But the moment that it is available, we strongly encourage families to get their infants and their young children all the doses that they're eligible for.
All right, Dr. Nili Kaplan-Myrth, thank you so much for joining us today and sharing your thoughts.
You're welcome.